Hi, my name is Brianna. I'm a nurse practitioner here on the units, and I'm going to be doing a assessment of your musculoskeletal system.
Okay.
Okay? So first we're going to start by checking your deep tendon reflexes. So I'm going to start by checking your bicep, your tricep, and your brachioradialis deep tendon reflexes. All right, so can you go ahead and flex for me? There you go. Okay, now relax. Okay. Good. Let's try one more time. Okay. So that one's intact and working properly. That's your bicep reflex. Good. Okay, good. Now we're going to check for your triceps. Yep, relax that arm on down. Good. Try one more time. Good. And on the other side. Yep. Good. Okay. Tricep reflex are intact. Next, we're going to look for the brachioradialis. Relax your hand. Okay, good. So those reflexes are intact. That's the bicep, tricep, and brachioradialis. Now we're going to check for the lower extremity, the knee jerk and ankle jerk reflex. So we'll just have to pan down for our camera. Okay. So relax your foot there. Go for it right there. Good. Okay, good. Now for ankle. Now look at the posterior part of your ankle here. Good. Good. All right, so lower extremity reflexes are also intact. Okay, now next we're going to move on to meninge signs. So we're going to go onto the yoga mat for these. So the patient has to be laying supine. So go ahead and lay all the way down for me. Okay, so for the first technique, we're going to do the Brzezinski sign. So I'm going to flex your neck. And we'll see. If she is positive for Brzezinski sign, then her legs will flex. Her knees will flex. I'm just going to support her head up. Okay. All right, so she has a negative Brzezinski sign. And then the next sign that we're going to check for is a Kearney sign. And what we're going to do is flex her knee and then straighten it. And if that's painful, that will be a positive sign. Does that hurt?
No.
Good. We're going to try the other one. Any pain?
No.
Okay. All right. Good. So she's negative for the meninge signs. Next, we're going to move back to her upper extremities. So come on over here again, please. And have a seat. All right, so first I'm going to inspect her upper extremities. I'm looking for any symmetry, swelling, or deformities, contour abnormalities, especially in the shoulders or the elbows. So her upper extremities look symmetrical. There is no deformities. The contour is even and equal. So then we're going to palpate. So first I'm going to palpate for muscles, tendons, and ligaments And I'm looking for any bony deformities or any bodiness. I'm going to palpate bilaterally to check for symmetry, checking for any boniness, bony deformities or any tenderness in her shoulders and in the elbows. Okay, and there are none present. All right, next we're going to start palpating the shoulders specifically. And I'm going to start with the sternocleidomastoid joint. Then we're going to move on to the olecranon vascular joint, the carotid process, the greater tubercle, bicep, tendon, supraclavian and subdeltoid bursa, and also the supraspinatus inflammatus and teres minors. So, okay, we'll do the same on this side. Next, we're going to move on to the elbow. What I'm palpating is the lateral medial epicondyles, olecranon processes, and the ulnar nerve. Let's see that elbow here. This is palpating for the olecranon process, the ulnar nerve, and the lateral and medial epicondyles. And everything feels within normal limits. Now we're going to move on to her wrists and her hands. I'm going to start with the distal radius, ulnar, radial, styloid bones, the olecranon, snuff box, carpal bones, metacarpals, metacarpal phalangeal, proximal and distal interphalangeal joints. So we'll start here. I'm going to palpate those bones, the processes, the radial, stuff box, the interphalangeal joints, metacarpals. Any pain or tenderness?
No.
Any pain or tenderness?
No.
Okay, next we're going to move on to the range of motion for the shoulders. So for flexion, I'm going to have you raise your arm just right in front of you. Okay, do the same on the other side. And then you're going to go up. So you're going to go like this. Okay, good. She has full range of motion for the flexion. Extension, we're going to go back like this. Put your arm back. Yep. Good. And do the same on the other side. Good. Any pain or any stiffness with that?
No.
Okay. Then we're going to move on to abduction. So you're going to take your arm away from you and all the way up over your head. Up and all the way up. Good. You're going to do the same on the other side. Good. All the way down. Okay. Then we're going to move over to adduction, which is bringing it over your body and all the way back. And then same on the other side, over your body and all the way back. Okay. Then we're going to do external rotation. You're going to, like you're trying to reach your ball strap, down. Same on the other side. Good. And then internal rotation, you're going to bring your elbow up 90 degrees and then rotate it down. Same on the other side. Elbow up and rotate it in and up. Okay. Now we're going to move on to elbows. So we're going to have her do extension. So you're going to go like this. Elbows, that's extension, and then flexion is this. Like you're flexing for an exercise. Next, we're going to do supination and pronation. So, pronation, supination. Pronation, supination. Any pain or any tenderness with that movement? Good. We're going to move on to the wrists. All right, so for wrist flexion, you're going to go like, put your hands up like giving me a high five, and then extension is going right down. Flexion is going down, then this is extension going back. Flexion, extension. Okay, how does that feel?
It feels fine.
Okay, and then for the ulnar and radial deviation, I'm going to take your wrist. We're going to go ulnar deviation, radial deviation. Any pain?
No.
Okay. The same on the side. Okay, then we're going to move on to the hands, specifically with the thumbs. We're going to do thumb flexion and extension. So flexion, extension, flexion, extension, flexion, extension. Okay? And we're going to do add and abduction. So this would be adduction, abduction, add and ab. How's that feel?
It feels fine.
Okay. So we got flexion, extension, flexion, extension, flexion, and got add and ab, adduction and abduction. Okay, pain on that side?
No.
Okay, then we're going to go to the fingers. So, we got flexion, extension, flexion, and then ab and adduction. Do the same on the side. Flexion, extension, and then add and abduction. Okay, feel okay?
Mm-hmm.
Okay, and during my assessment, I was looking for any bogginess, bone enlargements, any deformities or swelling, and she has none of those abnormalities. Now we're going to move on to the special test for the shoulders. It's called the empty can test. So what I'm going to have her do is she's going to elevate her arm to 90 degrees and internally rotate with the thumb pointing down. Go like this, and then I'm going to apply some pressure. And if she has a positive empty can test, that's going to be positive for a rotator cuff injury. Okay, ready?
Mm-hmm.
Like me. Good. She was able to maintain that position even against resistance. Next, we're going to go to the infraspinatus strength. And she's going to take her arms, elbows at 90 degrees, thumbs pointing up. And she's going to try and push out while I have resistance on her arm. So, elbows, thumbs up. Okay, you push up. Good, good. All right, next we're going to move on to the forearm supination. So you're gonna start out with your arms like this, and then you're gonna try and rotate them like you're holding a bowl of soup. So you're gonna go from like this to like this. Okay, and then I'm gonna apply pressure. So go back to the fist. Okay, I'm applying pressure, bowl of soup. Good. She was able to do that. The forearm supination, and then the drop arm test. You're gonna fully adduct the arm all the way to shoulder level, and then lower it slowly. So lower it nice and slowly. Good. Okay, do the same on the other side. Good. Good job. Any pain?
No.
Alrighty. Now we're gonna move on to the wrist. We're looking for testing for carpal tunnel. The first one is the Tinel sign, and all we do here is we just lightly tap over the medial nerve. Let's see your medial nerve. Any numbness, tingling in the first,
No.
second, or third fingers? Okay. Any numbness or tingling?
No.
Okay. Next, we're gonna do the failing sign. You're gonna hold your wrists and flex it for 60 seconds and press back to both hands together, just like that. Okay, so you're gonna count to 60. Hold that, just like that. Take it away from your chest, though. There you go. Yep. Okay, so she has a negative failing sign. All right, now we're gonna move on to your lower extremities, and the first test that we are going to use to check for your lower extremity is we are going to inspect how you walk. So go ahead and walk toward Buddy's cage and come on back. And what I'm looking for is a smooth, continuous gait and rhythm. Good. Nice and smooth, continuous rhythm with her gait. Now I'm gonna inspect. If you can remain standing, it's a little bit easier that way. I'm inspecting her lower extremities, looking for symmetry, swelling, and any deformities. Her lower extremities are symmetrical. Also, I don't notice any swelling on any of her extremities, and looking for deformities. If this was not going on the internet, of course, I would, have her remove her pants so that I could look at her legs a little bit more closely. Okay, next we are going to go on to the yoga mat. And we're going to continue our lower extremity assessment there. Okay, so now what we're going to do is palpate for bony landmarks. So I'm going to palpate her muscles, tendons, ligaments, any swelling or any enlargement. Go ahead and just relax. Just palpating the patella. Rest of her bones. Looking for any swelling or any deformities, any tenderness. Next, we're going to look at the hip, the iliac crest, anterior, posterior, iliac spine, girder trochanter, the sacroiliac joint, and the trabecular bursa. So go ahead and stand up for me. And you're going to stand right in front of the computer here. Okay, and then you're going to turn this way, turn that way. There you go. Okay, and I'm just going to palpate her hip bones. So, yep, I can feel her iliac crest right up in here. Where's the joints? Any pain or tenderness?
No.
Okay, all right, good. Then we're gonna move back to the knee. So let's go ahead and have a seat, and I'm gonna feel the mats. So what I'm looking for her knee is I'm palpating the tibiofemoral joint, medial and lateral menisces, medial and lateral femoral condyles, and medial and lateral tibial platus, medial and lateral ligaments, patellar tendon, tibial tuberosity, suprapatellar, and prepatellar bursa. Okay. And I didn't notice any deformities or asymmetries. Now we're going to move on to the ankle and the feet. So I'm going to palpate the anterior joint space, the ancillus, the tendon, the calculus, the plantar fascia, medial and lateral malleoli, metaphalangeal joints and grooves between heads and metatarsals. So that's with her ankle and the foot. Just palpating that. Can it see? Can't see this one. Any pain or tenderness?
No.
Okay. Alright. Now we're gonna test the knee for bulge sign and also for balloon sign. First for the bulge sign, I'm looking for any fluid in her knees. Okay, so move your arm to the side. So I will brush the fluid up and then brush it back down and look for a bulge in the interior of the knee. And I would do the same on the other side. And then, here we go. And look for some fluid on the interior of the knee. So she has a negative bulge sign for balloon sign. What I will do is compress the suprapatellar pouch against the femur and feel for fluid enlargement in the space between the patella. So just press down and then feel for some fluid in the spaces where the patella is. Okay. So next we're gonna move on to McMurray's test. So this is McMurray's test. Go ahead and lay on down. We're gonna flex it. Any pain?
No.
Okay. Lydia, get. Okay. Any pain?
No.
Okay. Alright, and then next we're going to look for the vagus stress test. And then the anterior and posterior drawer sign. Okay, so for the vagus stress test, go ahead, lay flat again. Any pain?
No.
Okay, same here. Any pain?
No.
Alright, now for the drawers test, we could do posterior and anterior drawer sign. So posterior would be this, okay, and then anterior would be this. And I don't notice her hips popping out of place or sliding forward or backward. Did that hurt you at all?
No.
Okay, I'll do it here. I'll do it here. Okay. Alright. Okay, next we're gonna move on to her spine. You go ahead and stand up right on that yoga mat so they can see. Okay, now turn the foot toward the window. The other window. And I'm assessing the curvature of her spine, starting from the C-spine, going all the way down. And it is appropriate for her height and her weight. So starting with the cervical spine, thoracic, all the way down to the lumbar spine. No deformities there. Now also I am inspecting for alignment of the shoulders and the iliac crest with patient standing erect and then flexing, noting any asymmetries. Okay, relax your arm, your shoulders, yep, and then flex your shoulders. Okay, now relax them. Okay, so everything is symmetrical and even. Alright. I already saw how she walked. Go ahead and walk just a few steps forward, probably like 5 steps forward and 5 steps back toward me, turning around at me, and back toward me. Alright, so the ease of gait, her ease of gait is within normal limits and it's very easy for her to walk. Okay, so while standing, I'm going to palpate any of her spinous processes for tenderness. So go ahead and turn around. And I'm just starting at the cervical spine, palpating for any tenderness of her spinous processes. Any tenderness?
No.
Next, what we're gonna do is we're gonna palpate the paravertebral muscles for any tenderness or spasms. So that's the muscles around the vertebrae, and we're palpating those for any tenderness or spasms. There's no spasms. Her muscles are nice and relaxed around her spine. And then next, I want to palpate her sacral joints for any tenderness. So that's her hip joints. Any tenderness?
No.
Okay. Then we're going to percuss over her spinous processes for any tenderness.
No.
Okay. All the way down to the lumbar spine. Okay. And then next, we're going to check out her neck. So I'm going to have you go toward the camera and put your neck down for flexion and up. Look at the ceiling for extension. Then you're going to look to your left and to your right. Okay, any pain or tenderness?
No.
Okay. Now you're going to do a lateral bending like this. How's that feel?
It feels fine.
Okay, and then we're going to do that for the spine. So for the spine, you're going to do flexion, touch your toes, extension, ooh, stretch your back. Ooh. Okay, and then we're going to do rotation. So this way, lateral bending. Alright, any stiffness, pains, muscle spasms?
No.
Alright, and that concludes our musculoskeletal assessment.